If you take your blood pressure medication with your morning coffee, you need to stop what you're doing and watch this. If you take your water pill after 2 p.m., same thing. And if you've ever doubled up after missing a dose, I need to talk. What I'm about to cover is what your pharmacist should have told you the day you filled that prescription. The most dangerous time to take your blood pressure medication. Thousands of patients on blood pressure medication. And there is one timing mistake I see every single week that most doctors never address in a 15-minute appointment. If you take your blood pressure medication in the morning or at night without knowing these specific rules, you may be cutting its effectiveness in half. Or worse, you may be creating a dangerous window where your heart and kidneys are completely unprotected. What I'm about to tell you is what I tell my own patients after the prescription is already written. The conversation that doesn't happen in the exam room. Stay with me because timing mistake number 3 is the one that surprises people the most. I created this channel because the information that protects people's lives in my clinic should not stay inside my clinic. Blood pressure medication is one of the most prescribed drug classes in the United States, and most patients are told what to take, but not when, not with what, and not what to avoid. That gap in information is costing people their health. Today, I'm going to walk you through the 5 most dangerous blood pressure medication timing mistakes, the ones that create real cardiovascular risk, reduce drug effectiveness, and sometimes trigger emergency complications. And I'll tell you exactly what to ask your doctor or pharmacist before your next dose. If this kind of honest clinical information is what you want in your feed, subscribe now. It takes 1 second. I put out one long-form video every week, and this is exactly the kind of thing I cover. Let me start with a class of blood pressure medications most seniors are on: ACE inhibitors and ARBs. Drugs like lisinopril, ramipril, losartan, valsartan. These are prescribed to millions of people every day. For decades, the default instruction was take once daily in the morning. It was a convention, not necessarily evidence-based. But research has shown that patients who took their blood pressure medication at bedtime had significantly better cardiovascular outcomes than those who took it in the morning. Lower rate of heart attack, lower rate of stroke, lower rate of death from cardiovascular causes. Why? Because blood pressure follows a natural rhythm. It dips during sleep, then surges sharply in the early morning hours. We call this the morning surge. That surge is when heart attacks and strokes are most likely to occur. A medication taken at bedtime is still active during that vulnerable morning window. A medication taken in the morning may have already peaked and begun declining. This isn't a minor optimization. The difference in cardiovascular outcomes between morning and bedtime dosing is clinically meaningful, and yet the default prescription instruction, take in the morning, hasn't changed for most patients. I want to be honest with you. The science on this is still evolving. Some studies show clear benefit to bedtime dosing. Others show no significant difference. The right answer depends on your specific medication and your specific blood pressure pattern. What I tell patients, ask your prescribing physician, should I be taking this at bedtime instead of morning? That one question is worth asking. If they can give you a personalized answer, great. If they've never considered it, that tells you something too. This one surprises people every single time. I have had patients who were doing this every morning without any idea it was a problem. Grapefruit and grapefruit juice contains compounds called furanocoumarins. These compounds block an enzyme in your digestive system called CYP3A4. That enzyme is responsible for breaking down many blood pressure medications, specifically calcium channel blockers like felodipine, nifedipine, and amlodipine. When that enzyme is blocked, your medication doesn't get processed normally. Blood levels of the drug rise dramatically, sometimes to dangerous levels. The result: an exaggerated drop in blood pressure, dizziness, fainting, and in some cases dangerous arrhythmias. Here's what makes this particularly serious. The effect of grapefruit can last up to 24 to 72 hours after you consume it. This is not just about the moment you eat it. A glass of grapefruit juice in the evening can affect your medication the following morning. If you take any calcium channel blocker for blood pressure, ask your pharmacist directly, is grapefruit a concern with this specific drug? Don't assume the answer is no. Ask. This is timing mistake number 3. And this is the one that surprises people the most because it's not about drug interactions or food, it's about something much simpler, and the consequences are serious. Diuretics, water pills, are one of the most commonly prescribed components of blood pressure treatment. Medications like hydrochlorothiazide, furosemide, and chlorthalidone work by making your kidneys excrete more fluid, which lowers blood volume and reduces pressure. The timing problem is this. Many patients are taking their diuretic in the late afternoon or evening, sometimes because they forgot their morning dose, sometimes because they were never given specific timing instructions. When a diuretic is taken too late in the day, you get the predictable consequence, frequent urination at night. Most patients accept this as normal. It is not normal, it is a preventable side effect of incorrect timing. And here's what I want you to understand about why this matters beyond just sleep disruption. Every time an older adult gets out of bed in the middle of the night, in the dark, sometimes disoriented, with blood pressure that may shift when they stand, the risk of a fall increases significantly. Nighttime falls in older adults are a leading cause of hip fractures. Hip fractures in patients over 70 carry a 1-year mortality rate of 20 to 30%. That is the real consequence of taking your diuretic at 6 p.m. instead of 8 a.m. The rule I give every patient: if you are on a diuretic, take it in the morning, ideally before 10 a.m., so that the peak effect runs through the day, not the night. If you are on a twice-daily diuretic, the second dose should be taken no later than 2 p.m. Most people who take beta blockers, medications like metoprolol, atenolol, carvedilol, propranolol, take them in the morning. And most of those people have their morning coffee at the same time or shortly after. Here's what's happening in your body when you do this. Caffeine is a stimulant. It activates your sympathetic nervous system. It raises your heart rate and temporarily elevates your blood pressure. Beta blockers work by blocking that exact sympathetic activation, slowing the heart rate and reducing the force of heart contractions. When you take a beta blocker at the same time as a significant amount of caffeine, you are simultaneously pressing the gas pedal and the brake. In most patients, the medication wins, but in patients with certain cardiac arrhythmias, the combination can trigger palpitations or irregular heartbeats during the period when caffeine peaks, roughly 30 to 60 minutes after ingestion. There is also evidence that caffeine can interfere with how certain beta blockers are metabolized, particularly metoprolol, in patients with specific genetic variants affecting drug processing enzymes. My recommendation, if you are on a beta blocker for blood pressure or a heart condition, wait at least 30 to 45 minutes between taking your medication and a cup of coffee. It is a small change. For patients with arrhythmia history, it may be clinically meaningful. This is the timing mistake I see most frequently and the one with the most variability in how dangerous it can be, depending entirely on which medication you are taking. A patient misses their morning blood pressure pill. They remember at noon or at 3 p.m. or at dinner. The common instinct is, I'll just take 2 tonight to make up for it. For some medications, this is relatively low risk. For others, particularly calcium channel blockers, certain ARBs, and beta blockers, doubling a dose can cause a sudden, significant drop in blood pressure, dizziness, fainting, and, in older adults with reduced vascular tone, a fall. There's a second version of this mistake that I see just as often. Patients who are prescribed twice-daily medications start taking them once daily because it's easier to remember, often without telling their physician. The blood pressure is partially controlled. The physician sees numbers that look acceptable. The medication dose is never adjusted. and the cardiovascular protection the patient should have is incomplete. The standard guidance is this: if you miss a dose and it is still the same day, take it as soon as you remember, unless it is close to the time of your next dose. In that case, skip the missed dose and resume your normal schedule. Never double up without asking your physician or pharmacist first, because the answer depends entirely on which medication you are taking. I want to be clear about something before we finish. Blood pressure medication saves lives. The evidence for treating hypertension is among the strongest in all of cardiovascular medicine. I am not telling you to stop your medication. I am not telling you your doctor made a mistake. What I am telling you is that the conversation about timing, about when you take it, what you take it with, and what happens if you miss a dose, is a conversation that often doesn't happen in a 15-minute appointment. And that gap in information has real consequences for real patients. If you are over 60 and taking blood pressure medication, or if someone you love is, here are the 5 questions to bring to your next appointment. 1. Should I be taking my medication in the morning or at bedtime? 2. Are there foods, supplements, or drinks I need to avoid around my dose? 3. What should I do if I miss a dose? 4. Is there a specific time of day my blood pressure tends to be highest? 5. Are there any timing interactions with my other medications? Those 5 questions asked clearly will do more for your cardiovascular protection than anything I can tell you in a YouTube video, because your physician has access to your full history. I don't, but I can give you the questions. If this gave you something useful, something you didn't hear in your last appointment, please share it with someone you care about who is managing their blood pressure, and subscribe, because every week I am going to keep giving you the clinical information that I believe every patient deserves. I'm 40 years in medicine, and this channel is the conversation that should have happened in the exam room. And I'll see you in the next video, in the